Hello and welcome to Bottom Line. Today is International Day Against Drug Abuse and Illicit Trafficking, and the theme for this year is Better Knowledge for Better Care. Well, Better Knowledge for Better Care emphasizes the need to improve the understanding of the world drug problem and how better knowledge will foster greater international cooperation for countering its impact on health, governance and security. Joining me also from Guwahati is Dr. Trideep Choudhury, consulting psychiatrist, Guwahati. Dr. Trideep Choudhury, such people, victims of drug abuse need help. Are they getting enough help? What do you encounter?
Yeah, good evening everyone.
Good evening.
Good evening. This addiction, it's a disease. It's a chronic disease of the brain. So we have to treat it like other physical illness. So whenever we talk about addiction, we have to, besides creating awareness, we have to look into the risk factors and other protective factors which lead a person to take substances. There are certain risk factors are there. For example, if he is having some biological vulnerabilities, for example, then if he is having some mental problems, if he is coming from a broken family, if he is from a marginalized sections of the society, if he has got some certain personality traits for which he is vulnerable to take substances. So these are the risk factors. Unfortunately, these risk factors are not in the control of the individual. So the society has to play a role, and we as healthcare providers has to play a role so that these risk factors can be addressed. Moreover, there are certain protective factors which help the person not to fall prey to this substance abuse. For example, if he has got affiliations to his family, if the family attachments are good, for example, and if he has got physiological, psychological, emotional well-being, then these are the protective factors which will help him not to fall prey. So we have to promote these protective factors. Moreover, it is seen that the adolescent group, they fall easily to this trap of substance abuse.
Basically, society has a big role to play. That's what you are pointing out. Of course, society has a big role to play. Dr. Trideep Choudhury, in your own encounter with some of the victims, some of the drug abusers, when it all started, when they took to it, was it also that cool factor that was there? It's perhaps cool to do this. Have you, I mean, that's something that we have also encountered, especially among teenagers who have been introduced to it by unscrupulous elements. Is that something which you also have encountered in your counseling sessions?
Yeah, a very good question. See, whenever we encounter these patients, most of the patients are in the adolescent group, and we know that in the adolescent group it is a transition period. During this period, they come in touch with the peers. The family monitoring are reduced to some extent, and they fall prey to this substance abuse. We have seen that these teenagers, it is seen that certain personality traits are very common. For example, novelty seeking. Novelty seeking means a person wants something new. So it is seen that in those persons or adolescents who fall prey to this substance abuse, the novelty seeking is very high, and these persons with high novelty seeking, if they come, they encounter those environmental factors. For example, if they come in touch with the peddlers, and if their coping mechanisms at the same time, if they are immature, then they easily fall prey to the substance abuse. So basically, it's the personality traits The environmental
So
influences.
basically we need a lot more focus at the school level, that's for sure. We need a
Yeah,
lot more
yeah.
awareness programs at the school levels. The parents should also regularly monitor their wards. Dr. Trideep Choudhury, last words, what is your advice to the parents, to society, to the school authorities, everyone, very quickly?
Yeah, addiction is a chronic brain disease. It has got a relapsing and remitting pattern, but unfortunately only biological measures will not prevent or cure the disease, and rightly it has been called the biopsychosocial model of treatment, and for that all the stakeholders, every portion of the society has to come forward to help us to take this problem, to take out the root of this problem and throw it away. Thank you.
Absolutely. Thank you so much. Society has to come together. Society has to help the law enforcing agencies, and it's a battle that we have to fight collectively. Thank you so much, Mr. L.R. Bishnoi, Dr. Hanse, Dr. Choudhury, Hasina Karbi, and of course, Dipanka for joining us on Bottom Line. We hope things do improve and we do win the battle against drug abuse. That's a wrap.